Hello, today we're going to be talking about grief. More specifically, everyday grief, how the 5 stages of grief apply to everyday life, and how you can use this knowledge to help yourself and people around you. My name is Dr. Ruben Gagarin. I'm your favorite child and adolescent psychiatrist. So let's dive in. Today I saw this very interesting patient, and she's 15-year-old. She has a tremendous history of abuse, trauma. So as a result, she doesn't quite care about herself and others. So she is involved in substance use. She has severe depression, recurrent suicidal thoughts, and self-harm. Today, we were talking about grief. I praise her for showing us some of the vulnerable side of her, meaning more sadness as opposed to anger that we usually see. And that was kind of progress. Baby step in the right direction. So in any case, we spoke about grief in general. So I asked her what she tends to do when she deals with a loss or grief. Her quote was, "Get high and get mad." So this was very interesting because sometimes I have this conversation that's about everyday grief, and I'll tell you how it is applicable. So let's step back and look at the theory of grief. So classically, there are identified 5 stages of grief. That is denial, that is bargaining as a second one, the third one is anger, then depression, then acceptance. I like to use example of traffic. For instance, if I imagine myself driving to work, so that I'm driving, I'm on the highway, and I see the red lights coming in front of me. I see that I'm approaching traffic and I'm probably going to get stuck in it, and I'm probably going to be late for work. So fortunately, in this example, I'm not losing anybody or really anything, but what I'm losing is my plan to be there at work on time. And that surprisingly triggers a chain of grief reaction. So what happens when I see those red lights? Well, I do nothing. For the most part, I do nothing the first second or two. I drive at the same speed, and back in my mind, I'm guessing, I just hope that if I ignore the problem long enough, it's going to disappear. And in reality, a lot of the problems do disappear if you ignore them long enough. So that is a valid strategy. Not in my example with traffic, of course. In a second or two, I approach too quickly, so I need to do something about it. So of course I slow down, but what happens in my mind is that I start thinking about options. So should I change the lane? Should I leave the highway? Should I do something to avoid the traffic? Well, that is bargaining. That is the second stage of grief. Sometimes it works, sometimes it's not. For the traffic, usually it doesn't, especially on the highway, as you know. But in real life, of course, bargaining is the main way how we can avoid going into further stages, and we may just deal with the problem. We may be able to negotiate some sort of deal and then move on with our lives. So in my example with traffic, of course, me changing lanes changes nothing. So I move on to my next stage. So now I'm stuck behind a whole bunch of cars. And I get angry. So what do I do? Well, I personally maybe yell something. But what I might want to do is actually to push the cars a little bit. Maybe they're gonna move a little bit faster. If I was a little bit angrier, I suppose, I would think about jumping out of my car and start kicking them, or maybe smashing windows with a baseball bat. So is it gonna help? Not in this situation. Of course, I would get stuck for longer. I may get arrested. I may never get to work. So therefore, I quickly abandon that strategy, and my mind jumps to the 4th stage, which is depression or sadness. I feel sad. I feel hopeless. That essentially, literally means I lose hope of getting to work on time. I run out of options, so I feel sad. With the traffic, I usually don't get stuck in that sadness, whereas when it comes to real grief or loss, people tend to spend quite a lot of time in the sadness stage Well, in my case, I move on pretty quickly. And I jump to the last stage, which is acceptance. Now, this is a tricky one. Sometimes I talk to my patients and they don't quite understand. They say, well, how can I accept something that I really hate? I don't like this loss. I don't like grief. I cannot accept it. Acceptance doesn't mean that the person is okay with it. It's accepting of reality. So in my case, I am accepting that I'm stuck in traffic, and I'm also accepting that there is nothing realistically I can do about it to get there on time, that means. So the only thing I can do is call my work, maybe let them know that I'm getting late. So doctor's privilege, they usually go easy on me, so I can tell them that I'm going late, and maybe there are certain things I can do over the phone. And once that is done, now I'm free. So once I've gone through the 5 stages of grief through acceptance and taking options that are based in reality, I kind of free myself. Now, I don't feel sad, I don't feel angry, I'm relaxed, I know that everything is taken care of, so I can crank up the music, maybe listen to my favorite audiobook, or maybe listen to a podcast, or maybe call my friends, whatever I want to do. If I had Tesla, maybe I start watching Netflix, I'm not sure. I don't have one. So, in any case, these 5 stages of grief that we go through pretty much every day on smaller scale. Sometimes once in a while we may have to go through the stages in a big scale, and occasionally we may get stuck in certain stages. I'm going to go over them again. So when we hit with stress or loss, the first thing we do, we try to ignore the problem, which is denial. So we try to ignore it long enough so it disappears. If that doesn't work, we move on to bargaining or trying to find compromise or negotiation. If that doesn't solve the problem, we move on to anger and we try to fight the problem. So occasionally works, usually not in a civilized society. So then we move on to depression. So the purpose of depression is actually to help us to let it go. So like when we lose hope, it actually opens the door for looking at realistic possibilities. The reason why we lose hope, because there are no viable options that we see in the moment. So we have to go through depression in order to get to acceptance and then consider realistic options. So the acceptance is the 5th stage. Denial, bargaining, depression, anger, depression, and acceptance. You may have a question. How this conversation about grief is applicable to our case that I started with? Well, remember what she said? When she's faced with the grief or loss, she gets high and get mad. So what is get high? Well, that is an interesting question. That is the whole different video about addiction and emotional reasons for it. Please look down the list, maybe you'll find it. But getting high, essentially in this context, means denial. So denial of the loss. So a person gets high, so they don't have to deal with it. So basically they check out as if the problem does not exist. Get mad, that would be anger. So this person who I'm talking about, she jumps from denial to anger. So there is very little room for negotiation. So since we first met, over time she learned how to negotiate because we're giving her proper feedback, we listen to her, we're trying to compromise, so she tries to learn from us, probably subconsciously. Nonetheless, she's learning. However, so that before, because of the trauma and abuse that she went through, she unfortunately experienced a lot of disregard of her voice, what she wanted to do, her feelings. People took advantage of her. So because of that, she doesn't see any value in negotiation, or didn't used to. So now she told me that typically she jumps from get high, which is denial, to get mad, which is anger. And because the depression is unacceptable, since she has been fighting for her survival, she doesn't let herself to experience depression. She doesn't even aware that she has depression, or she wasn't aware before we started treatment. And then of course there is no room to get to acceptance if you never get to sadness. Now, why it is important for you to know? Well, if you know the stages, you may help others or may help yourself to move through them. It helps you, first of all, to understand what the other people may be going through. And that is important. So if a person is in denial, you just need to support them. You just need to maybe help them. And that is a little trick how you can do that. So you help a person in denial by pointing out some of the inconsistencies in their logic. So for instance, if I keep driving at the same speed and I'm approaching traffic, my wife can tell me, well, on one hand, you're driving fast at the same speed. I understand you want to get to the point quickly. On the other hand, we're going to hit the traffic and cause a car crash. So please slow down. So like pointing out these two sides that seemingly contradictory or like exclude one another. So I cannot drive at the same speed and not to crash. So then it kind of triggers that reaction for me and may stop me from denial. So maybe I'll move on to the next stage. So bargaining, a very important stage. That is the way how most of us deal with problems in life. So maybe if you're helping somebody who is trying to find their way out, maybe you can brainstorm, maybe you can help to find compromises. So if somebody is really angry, you need to just give them space. There's usually no reasoning with a person who is extremely angry. Again, you just need to support them, give them time. Don't try to talk them out of it. Try to ask maybe if there's anything you can do to help them. So if you find somebody in depression, and that I'm sure that you know some people who kind of get stuck in depression, especially if they have a loss of loved one or maybe loss of something that was significant or important to them. So in depression, you just need to appreciate and you should respect the person's space, that they need to go through depression as well. This is a meaningful stage. It is causing a lot of suffering, and the important thing for you as a person who is trying to help is accept the fact that you cannot stop another person from feeling depressed. Sometimes you can cheer them up. So if it is not clinical depression, it works. When I lost my mother, I was going to work. I was joking with my friends and colleagues. So it kind of eased me a little bit. So then I kind of forget about my loss, so I can cheer up a little bit. If I was home alone, I wouldn't be able to do that. So if it is clinical depression, typically cheering up doesn't really work. So then the person may need professional help. You may take them to counselors or psychiatrists. And very important point, if during that depression someone expresses suicidal thoughts, that is a strong red flag for clinical depression. You may need to take that person to emergency room. The last stage is acceptance. Once a person is in the acceptance stage, they still may feel sad. They probably will be feeling sad about the past, about their loss. So that part is normal, the sadness is normal. So acceptance means that now they should see realistic options available to them. So that is my video about everyday grief. I hope it helps you to understand what you're going through or how to help people around you. So if you like these videos and you want to watch the next one or see notification, please subscribe, buy me coffee, whatever you want to do to support this channel. Thank you very much. See you next time.